Hi, welcome back to the second part of the ST3 application process for 2026. I'm Ruchira, and I'm going to talk you through the next sections of the application. The second section is for a good quality audit or a quality improvement project that you've done. So you must describe this audit or QIP and then your role, any change in practice that happened as a result. Uh, in this section, you will be scored out of 6, and the highest points are for demonstrating evidence of having led and presented a good quality audit or QIP at a regional, national, international meeting, as well as description of results, recommendations, along with evidence of change. I appreciate it's quite a difficult one. I'm pretty sure not many of you have uh, a regional or a national presentation of the audit, but by the time you're planning to apply for ST3, it is expected for you to at least have a good quality audit or QIP and presentation at a local or departmental meeting. So, which gives you 4 out of 6, which is good. So number 4 states evidence of having led and presented a good quality audit or QIP at a local or departmental meeting, as well as description of results and recommendations. So what you lack in experience, you can always compensate for it via a very clear and structured description of the project. Um, can I have the next slide, please? Um, I'm sure all of you are aware of these stages of the audit cycle. Uh, you require a good quality audit for this section, the best one that you've done so far, and there should be evidence of having designed and led, which means that you cannot merely mention that you have designed and led. You have to explain the whole thought process. And I know it should be all within 50 words, but it's really important that you describe this whole process, that how you identified the issues, how did you collect the data or implement change, and then if you've done a re-audit or planning to do a re-audit, to make sure that there has been some sort of improvement in the service. Um, and all of this should be your proactiveness should be evident on this whole answer. Uh, yeah. Next slide, please. Uh, a quality improvement, it's similar to that. It should be aligned with NIHR standards, and you must follow evidence-based medicine. Your answers will look better if you are able to use technical terms like a PDSS cycle, or mention that you've used a fishbone analysis during your QIP. Just make sure that your active involvement is portrayed in your answer.
Can I ask a quick question?
Yeah. Yes, Nadia.
Do you remember what your project was, or is there something, because quality improvement sounds quite fancy, is there
Yeah.
something, it's generally, I think I'd suggest if you've done a change in your department, you've gathered some information about what people wanted or what
Yeah.
the problem was, you've checked out a change and you've implemented a change based on recommendations, that is a quality
Yeah.
improvement. So you might be
Yeah.
able to make a project you have
Yeah.
package it as a quality improvement, because a quality improvement is basically identifying a problem finding out what would work, trying different ideas, and
Yeah.
then reviewing it and seeing if it works. So it usually has audit within it. Do you have an example of something that you
Yeah.
did, or
Yeah. So I
sounds
can.
very fancy when you describe it like this, but I think people might not realize that they probably, if they've been working in the NHS, they will have already done this. If they're working overseas, they will have certainly probably done an audit against some kind of standard national or
Yeah. Yeah, sure. I remember for my ST3 application, I described an audit that I did in the postnatal ward. It was about this neonates who were born to maternal thyrotoxicosis pathway in the department. So during this audit, I noticed that this pathway was really difficult to read. It was very worded pathway, and not many staff members were aware of the full content. So we decided to analyze all the data and make a list of all the babies who've gone through this pathway and whether the pathway was compliant or not. And based on that, our recommendation was to educate uh, all the staff members for this. I had to liaise with midwives, my pediatric OPD nurses, or outpatient nurses, and my own team. I did a departmental presentation, an audit presentation for this, and we basically we kind of conducted an awareness campaign uh, to just make sure that everyone knew what this pathway entailed. We also did a re-audit next year, the following year for this, and so the initial audit showed that there were lots of babies were missed. For the screening, or there was really poor documentation, or the follow-up wasn't timely. But in the re-audit, our compliance, that was much better. So, the way that I, presented this was basically after having, you know, So what I want to say is, I can't remember the exact structure that, it's just 50 words, but I basically just described my thought process that the pathway was difficult. We audited the pathway, we made some changes and disseminated the teaching, made sure that everyone was aware of it, and then re-audited this. And during all of these things, my learning was I improved my confidence level on how an audit is conducted. I improved my communication, networking skills, and things like that. So, I mean, there are a lot of things that you can reflect on after an audit or a QIP.
great, that's
So,
really
yeah,
helpful.
that was my
And I guess
example.
just
Yeah,
really clearly saying that I designed and led, or I identified a gap, or
yeah,
showing that you were
yeah,
really actively involved. Okay, I think that.
yeah, yeah. Right. So the next section is on leadership. This section you have to note that this is not a clinical leadership scenario. So you must give description of an example where you've shown leadership or management skills in a non-clinical context. You have to also choose from a drop-down menu about the leadership role. It could be a rota organizer or a shift coordinator, a lead role as an undergrad doctor, or it could be a local, regional, or national level role. And then you have to describe the delivery and impact that you've had in this role, and and of course, you have to then reflect on your personal or professional development. You get scored out of 5 in this. And uh, number 5 says if you've had a lead role as undergrad or junior doctor at any level with demonstration of delivery or impact with well described evidence of personal and professional development. I think this, for me, I think this is the easiest section. You must aim to get full marks in this uh, because at this level, all of you have lots of experience at managerial level. So yeah, this answer should be really well structured.
Any suggestions of what they could put or what you put?
Yeah, so I was so my answer was that I was a teaching rota organizer in one of the DGHs, and for this, like I designed the whole teaching calendar. I communicated with all the presenters well in advance, then disseminated the schedule to all my team members. Took formal feedback to make any sort of changes uh, and yeah, and learned a lot in this process. So again, you can for leadership situations. So in the next slide, I've mentioned a link. Can I have the next slide, please? So, so this link basically takes you to a beautiful leadership framework by Leadership Academy NHS. It gives you a very good understanding of the qualities or behaviors that is expected out of an effective leader. So you can please go through it. It's going to help construct your answer uh, in a really clear manner. So yeah, in my scenario, I have used. Uh, so I designed and I led this teaching calendar. It would be nice to also mention your target audience and your commitment to the whole process, like whether you have like how much time you have dedicated to this and how you've communicated with other people, that you've used your organizational, your teamwork skills, or you've involved MDT in this. And then you've improved yourself in the process by taking formal feedback. So you're also like quite open as a leader. You want to make changes in the system, but you also want to improve yourself. So those are good qualities of a leader. So yeah, you can take a lot of guidance from this framework. So please go and read it. Thank you, Nadia. Was that okay?
No, I was just, are you ready for the next slide?
Yeah.
Yeah, nothing to add to that. That's really helpful.
Yeah. Um, the next section is on research or your academic achievement. You have to provide 2 examples of good quality research or any academic achievement that you have. And also describe all the aspects, your role, and what and the nature of the project or academic work. This year you also get an additional point for research qualification, but keep in mind that if you have a research qualification, that does not mean you automatically get 5 points. You still have to structure your answer really nicely and describe the whole research methodology. So the highest score in this is 4, and which says detailed description of involvement in research or academic work with at least one of national or international presentation or publication as first or last author. I feel and this is the most difficult section to get the highest score. Um, most of the IMGs that I've worked with did not have this, but also like many of them, like they do have a postgraduate training from their countries where they have led a research project for their thesis or dissertation. So don't be disheartened. You'll still like you have loads of experience. If even if you get two score out of four over here, which says a detailed description of involvement in research or academic work with presentation at a local or regional meeting, you still have like the rest of the section. You have loads of experience in clinical capabilities. You should aim to get highest scoring on that, along with teaching and leadership. So, I mean, if you lack a little bit in these in research or audit or and QIP section, I think it should be okay. Can I have the next slide, please? So, a good description would be if you are really clear about your active involvement in the project, and if you can describe how did you think about this project? How did you collect data or perform data analysis or wrote up your paper or the research project as a thesis or dissertation. So yeah, it's all about structuring. Make sure you make it really technical, describing all the aspects of designing a research and conducting it. There is, I would like to, elaborate what research MD means. So it has been defined as a university awarded degree purely based on original research for at least 2 years. So if you've done your postgraduate training in your country with just a dissertation, that does not qualify as research MD, just to be clear. Yeah, and for this section, even I had two dissertations, one when I did my MD in pediatrics and one when I did my neonatal fellowship in India. So I described both of them and that I designed and led these research projects, and also like I collected the data myself by whatever methods that you've used. I analyzed them by XYZ software or used a colleague for some help or the consultant for some help, and then wrote my thesis. And as I said, the last line should be on your reflection, what you learned in this process, and how you plan to change your work. Like, yeah, you could describe it like this. And yeah, if you've done a local or departmental presentation of your research, then yeah, you'll get 2 marks out of 4 in this. Next slide, please, Nadia. Okay, and the last section is on teaching. You have to provide 2 best examples of your teaching work and describing the exact nature of your involvement and any sort of formal evaluation that you've carried out or improved. This year, you have an additional point for educational qualification, that is a PG certification or postgraduate diploma, MSc. But again, having an additional qualification does not mean that you get 6 points. You still have to structure your answer systematically. So 5 points is for clear evidence of designing, delivering, and leading education teaching, including evaluation from learners and utilization of feedback for future sessions. So, my top tip, what I used in my application was, writing in a really structured manner, like perform the full cycle of designing the teaching. So, how did you design the teaching? Was it based? Can I have next slide, please? Not yet. So, did you assess the learning needs of the participants, or was it based on the curriculum? And you can deliver it via several methods. Can be bedside teaching, or if you've used simulations for learning. The more innovative it is, the more scoring you get. So add, you know, I mean, if you've ever used quizzes, polls, or any other innovative methods, then do mention it. Also, it is nice to,
Can I add something there?
yeah,
I was going to just say as well, like different multimedia things as well. So
yeah,
you can say that you've learned, you've done bedside, but you've also done, you've written it there, but bedside, but also simulation. And in terms of you've delivered online teaching and thought about how to maximize
yeah,
engagement. And it's
yeah,
important. The next thing that you're going to point out, but is evaluate, like how do you continually improve? How do you check
yeah,
that you're delivering to the right standard, and then that you're reviewing and evaluating that it's being received by the students at the right level, and then how are you refining and improving it for next time and learning to be a better teacher, medical teacher
yeah,
each time, isn't it? They want to hear
yeah,
that kind of thoughtfulness around, like,
yeah.
how do you continually improve yourself?
Yeah. That's right. That's right. Yeah, you can use a variety of things. You could also, like all the technical skills. Like recently, I've attended a teaching where there was a clinical escape room. It was quite interesting. So you have to make sure that you are showing that you are able to engage people of various levels and in various settings. It would be nice to mention, what sort of group uh, this teaching was targeted at, and what was the setting, like whether it was a seminar kind of teaching or a large lecture, a virtual teaching. So yeah, you can mention all of these things. Also, it's really important to get formal feedback by this time, especially if you've worked in the NHS. I'm sure you must have like gone through this whole process of obtaining feedback. So, and whether you've made any improvement or changes after you got your feedback. So, uh, again, it's really important you reflect on this teaching experience. So, you have to uh, yeah, you have to mention your learnings, how, so what were the skills that, you felt im improved after your teaching? So it could be technical skills, like it could be communication skills, it could be just organizational skills, whatever you can use all of these for your answer. Um, and that's it. Nadia, do you have any questions on this? And of course, like you have to like start doing your application as soon as possible, if not started already, because you have to give enough time to yourself to get some feedback from your seniors and then refine your answers. So this process takes a long time. So please don't leave it for the last minute. To summarize all the slides, just go through the RCPCH applicant guidance thoroughly through the scoring framework, and there's a glossary attached to the scoring framework. Please go through this glossary. It's really important because it mentions like the expectations of the answers. Also, as I said before, please write the application well in advance and obtain feedback from seniors, especially the ones who have recently and gone through the same process. They are the best people who can like judge, but also like you can take feedback from your other consultants because they can give you different perspective on your answer. They can help you with that. So that's it. All the very best for your
Well, yeah,
application.
and I was
Yeah.
just going to add what you were saying because I looked through people's application forms, and you're right, and you're probably looking through other people's application forms as well now, Ruchira, as well. Now that
Yeah.
you've got the expertise, but definitely give them your form well in advance. Give them the scoring sheet as well, because this year is different to next year, and people who looked at last year's ones might not be aware of that. I wasn't aware of that. I was still using the 2025-26 guideline. I think they've only quite recently put it up on the website actually. So just be careful. Give your seniors both your application and the scoring framework and highlight to them the changes because that's really helpful. Maybe even use a screenshot from Ruchira's slides today just to kind of help them to realize that you're going to be marked slightly differently and tell them the deadline so that they can triage their list of jobs so that they don't give it to you like on the day that needs to be submitted, because that will be really hard for you to then make use of that valuable input. So those are the only things really that I would say. And definitely watch the video on the RCPCH website because they've done the ST1 and ST3 one. I'm not sure how much detail it goes into, but you shouldn't put in an application without kind of hearing from the horse's mouth exactly what they are expecting from you so that you can offer it back to them in the way that they want. And that's it really. I hope this video is helpful. I'll leave you, Ruchira, to have the last word because it's your presentation. And thank you so much for coming and doing this last minute offer so that we can keep you guys up to date with what's happened this year with the changes. But I'll let you hand over to you, Ruchira, to just close and say thank you so much.
Yeah.
And next year we'll hopefully do a live event for you all.
Yeah. I just want to say that if you have any questions regarding, can we move on to the next slide, please, Nadia? Because that has my email address. So if you have any questions or need guidance, even if it is for the smallest thing, feel free to email me at this email address. I will try to reply as soon as I can. All the very best for your application, and thank you for listening. That's
Okay,
it.
thanks so much, everyone.
Yeah,
Thanks,
yeah,
Ruchira. Bye.
yeah. Bye.